Cal Poly is a very diverse university. It's a great university, and it has a lot to offer. And one of the reasons why I'm happy to be here as an instructor is because I'm around people that are so smart and so dedicated, especially the young people, your generation. I only say this because student evaluations are coming up. And I think that all of you are very open-minded and not as close-minded as past generations in terms of issues of sexuality, diversity, issues regards to mental illness and things of that nature. So for us here today, or for myself as an organizer of this event, the focus today is to demystify mental illness in working class Latino communities. But it's also looking outside of Latino communities as well. So mental illness doesn't limit itself to Latinos, but this is the focus of my research. What I do that has to do with Latinos and Latinas in the United States. As you all know, immigrants are under attack in this country. So as a son of immigrants, I'm also someone that is an advocate of immigrants and defends their rights, their human rights to be here. So we have two excellent speakers and experts, and I'll present them in a second. But I would like to start with a few comments about mental illness. This is something that, like the word immigrant, is stigmatized. So there's a stigma to mental illness. Like if you suffer from mental illness, the way Hollywood makes us feel, the way television makes us feel, the way elected officials make us feel, is that you should be ashamed of it. And for me, I don't feel that that's necessarily the case. There's no shame in mental illness. In fact, it runs in my family. When I say family, I don't mess around. I'm talking family, like extended family. I have 7 brothers and sisters. I have 10 aunts and uncles, and I have 100 first cousins. So we don't mess around when it comes to families. And it runs in my family, and I'm not ashamed of it. I feel that if you or your family members suffer from mental illness, you should look at it the same. At the end of the day, mental illness doesn't define who you are. All it is a medical condition. That's it. It's not who you are. If somebody suffers if you're a diabetic, you don't say, oh, there goes a diabetic. Or if you suffer from a heart disease, you don't say, oh, there's a heart disease guy. So what's the difference? It's a medical condition. That's all. So once we treat something as a medical condition, and the fact of the matter is, it's not abnormal, it's normal. In the United States, over 44 million people suffer from mental illness at any given year, according to the National Alliance of Mental Illness, NAMI. And unfortunately for Latinos, there's 57 million Latinos in this country, 3 million Puerto Ricans, so there's 60 million of us. Unfortunately, Latinos access mental health services 50% compared to whites. So there's a big problem in the Latino community, in the Latina community, when it comes to mental illness. And part of it is lack of education, part of it is the stigma, and part of it is how we see ourselves, or when you see people that suffer from mental illness in Hollywood, in motion pictures, the way they're portrayed. As if you should be ashamed. And there's no shame in it. There's no shame in it. And there's nothing wrong with you if you suffer from mental illness. All it is a disease like any other disease that we're going to suffer at one point in time in our lives. We all have something, and the older we get, we're going to get something. We're going to get dementia, we're going to get heart problems, we're going to get diabetes. We're all cancer. There's so many diseases out there. So what's the difference between that and mental illness? And to me, the mind and the body is the same, so we can't separate it. So this is why I do these things, is to organize, and also because I need a raise. That's why for every person that's here, I get like a $1 raise, so I'm happy about that. And I could buy my son a Nintendo. He only has 3, but whatever. I'm not. Who's counting? So for the Latino and the Latina, too often, because our parents, especially those of us that are son of immigrants and daughters, Too often when we go to the hospital, when we go to the doctors don't speak Spanish. The doctors they don't look like us. So you're 10 years old, and tell me if one of you is in the situation. You're 10 years old and you're translating for your mother. You know, Dr. Gomez can attest to that. You're 10 years old and you're transferring for your mother, and then sometimes you get the wrong information. That's why they operated my mom's left foot and turned it right, because I didn't know the izquierda derecha, you know. So there's an importance here, not just to advocate for mental illness and the importance of it, but to advocate for young people like yourselves that come from diverse communities to also represent that profession, to become doctors that speak Spanish, that know the culture, so that when your mother that speaks Spanish sees a doctor like Dr. Cardenas or Dr. Toriz, they see somebody that looks like them, that understands their culture, that can speak to them in a language that they understand. So it's not just about us talking about mental illness at the university, at the great university of Cal Poly Pomona, but it's also that when our parents or grandparents go to the doctor, that those doctors that they see come from the university, like the one that we're in at the moment. So not to put any pressure on all of you, but you're obligated, if you come from diverse communities, to become doctors and lawyers and teachers, so you become those role models so that you can tell people it's okay, you know, no hay problema. Nomás tómate esta pastilla y todo va a estar bien. O podemos hablar de sus problemas. Because too often with the Latino community, our network system, it's a network system of support, but it also can kind of bring us down. Because instead of seeing Dr. Cardenas or Dr. Toriz, you know, we see the comadre or the compadre. And for the men, it's like the compadre is like our therapist, but we're at the bar, you know. Gracias, compadre. You know? Right, so we're not seeing the professional help that we need to deal with medical issues that are far beyond what our family can support. Because you have to be a doctor, you have to be an expert. And even far beyond what a priest can support, because they're not qualified medically speaking. Because you're not going to go to a priest to have a heart operation. So why are you going to why go to a priest when you have bipolar, where it takes medical intervention with diagnosis, with medication, with therapy, and so on and so forth. So these are the reasons why we're here today and why we're filming this, to spread the word that these are important issues that we need to deal with. So that being said, our first speaker is Dr. Jeffrey Cardenas. Dr. Cardenas received his bachelor's from UCLA in psychobiology. I can't even pronounce it. That's why I didn't go to medical school. That's why I was a history major. In psychobiology, he's like me, and like Dr. Gomez, who's with us today, as first generation university student. He's after UCLA, he went to a small school in the East Coast, Harvard, where he received his MD at Harvard Medical School. And currently he's a psychiatrist. He works at Olive View Medical Hospital, run by UCLA in the psych ward. So today he's going to give us a presentation about mental illness and speak to us about some of the technical terms that we all can learn from. So round of applause for Dr. Cardenas.
So I'm going to have to apologize in advance because I'm not nearly the speaker that Dr. Huerta is, so I apologize if I'm a little bland. My name is Jeff Cardenas. I'm a psychiatrist. I work in the psychiatric emergency room at Olive View UCLA Medical Center. It's a county hospital in the San Fernando Valley. And I want to talk to you guys about mental health issues in the Latino community. So I'm going to do a dual thing here. This is an outline of what I'm going to be talking about. We'll be talking a little bit about the epidemiology, rates of different mental illness in the Latino community. I'm going to be very broadly speaking about how do we diagnose, and very broadly speaking about the treatment modalities that we have. And then we'll talk a little bit about barriers that Latinos face in accessing mental health treatment. And then I'll leave you with some resources that you can access or tell a friend or a family member to access if they need some help. So I'm going to be talking about some large epidemiological studies that looked at different rates of different illnesses. The first one is called the National Comorbid Study. It was done in 1994. And what it found was that lifetime rates for mood disorders were about 20% for whites, 18% for Hispanic Americans. And you're going to excuse me here, I'm using the term Hispanic Americans. I prefer Latino, but I'm using the term that was used in these studies as a demographic. So, excuse me for that. 13.7% for African Americans. And what they also found was that lifetime rates for anxiety disorders were about 29% for whites, 28% for Hispanics, and 25% for African Americans. Lifetime rates for substance use were about 30% for whites, 23% for Hispanics, and 13% for African Americans. Mexican Americans were found to be at a lower risk for substance use disorders and anxiety disorders than whites. So what this study concluded was that members of disadvantaged racial and ethnic groups in the U.S. don't have an increased risk of psychiatric disorder, but once they have the diagnosis, they tend to have more persistent disorders. Now, you may ask, why is this the case that there's lower rates? I mean, part of it is just people aren't seeking help, and so there's people like Dr. Huerta mentioned will go to their priest, will go to their compadre, won't go to a psychiatrist, so they're not counted in the numbers. Okay, this is another study, the National Health Nutrition Examination Survey, and it found that lifetime rates for major depression for whites was about 10%, African Americans 7%, Mexican Americans 7%, and then there's the National Epidemiologic Survey on Alcohol and Related Conditions, which found the prevalence rate of 1 year for alcohol use disorders was about 9% for whites, 9% for Hispanic Americans, 7% for African Americans, 4.5% for Asian Americans, and 12% for Native Americans. Lifetime rates for major depression was 11% for Hispanic Americans and 18% for whites. So now I'm going to, let's see if this works. Okay. Now I'm going to very broadly talk about how we come up with our diagnoses. We unfortunately are not there yet with having a blood test or having an imaging study like a CT scan or MRI that is going to definitively give us a diagnosis, a psychiatric diagnosis. We're not there yet. But so what we rely on is whether somebody meets criteria or not for a mental disorder. And so we use this, which is called the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. We're on the 5th edition of this. This was published in 2013. And what you'll find in there is 22 major categories of mental disorders and 150 discrete illnesses. So I'm going to just very broadly, again, go over some of the more major categories here. So, for example, we have schizophrenia spectrum and other psychotic disorders. And within this, you'll have diagnoses like schizophrenia or schizoaffective disorder. We have bipolar and related disorders. So within this, you have bipolar 1, bipolar 2, cyclothymic disorder. We have also the depressive disorder category, where we find major depressive disorder, persistent depressive disorder, and anxiety disorders like panic disorder, generalized anxiety disorder, specific phobia, social anxiety disorder. These are some of the more prevalent, actually, disorders in the anxiety disorder category. A lot of people suffer from anxiety disorders. Other major categories are neurocognitive disorders. So you may have heard things like dementia, like Alzheimer's, that's in this category. Substance-related disorders, such as alcohol use disorder or amphetamine use disorder, and obsessive-compulsive and related disorders like OCD, trauma or stress-related disorders like PTSD, and neurodevelopmental disorders like ADHD, autism. We also have personality disorders like borderline personality disorder. Okay, so that's just a kind of a broad mention of the different diagnoses that you could find in there. So once you do receive a diagnosis, that's going to guide the clinician in terms of what kind of treatment they're going to offer you. And it could be medications, or it could be therapy, or it could be some other kind of support. There's other treatment modalities which I'm not going to go into, but I'm just going to mention some of the main like medication categories and therapies. Okay, so in terms of medications, we have a group called antidepressants. And usually we use them for major depression or anxiety disorders. They can be used in other disorders as well. One of the more common antidepressants are what we call SSRIs, selective serotonin reuptake inhibitors. And an example of these would be like fluoxetine, sertraline, paroxetine. We also have selective serotonin norepinephrine reuptake inhibitors, such as venlafaxine, duloxetine. And then we have other antidepressants with unique modalities or mechanisms, such as bupropion, mirtazapine, nifazodone, vilazodone. We have older antidepressants that have a little bit more side effects, but we still use them. These can be particularly helpful for like pain issues, physical pain issues, like amitriptyline, imipramine, desipramine, and then monoamine oxidase inhibitors. So these are kind of the major categories of antidepressants. We also have medications that help to treat bipolar disorder, and we loosely term these mood stabilizers. And in this category, you'll find things like lithium, Depakote, or valproic acid, carbamazepine, oxcarbazepine, lamotrigine, and also we use the atypical antipsychotics like olanzapine, risperidone, Abilify, or aripiprazole. Oh, did I not advance this? I didn't. Sorry. Okay, and then we also have a category called antipsychotics. These are used in mood disorders or psychotic disorders, and we divide this into first generation and second generation. The first generation being the older ones, they tend to have a little bit more side effects like haloperidol, fluphenazine, chlorpromazine, and then the second generations like olanzapine, risperidone, aripiprazole, quetiapine, clozapine. So a little mention in terms of therapy modalities. I think it's important that when you go seek a therapist, you find out what kind of therapy they're going to do. Because not all therapists are trained in all of these different styles. And some therapists might be solely trained in CBT or DBT or that kind of thing. So just a little mention about what these therapies are. So the first therapy is called cognitive behavioral therapy, and it's used for treatment of depression, anxiety disorders, or other disorders. It's got the most data in terms of efficacy in treating different illnesses. And we also have interpersonal psychotherapy. This tends to be more targeted for when you are suffering with grief or role transitions or interpersonal disputes or some kind of interpersonal deficit. There's, of course, psychoanalysis and the psychoanalytic psychotherapy. This is what you think of when you think of Freud, when you think of like a therapist at the side of a couch and you're laying down on the couch free associating. This is a psychoanalysis. But you'll find that a lot of the principles in psychoanalysis we use or therapists will use because they're very helpful. And so these treat anxiety disorders, personality disorders, depression. There's dialectical behavioral therapy, which is a very good therapy for people who have borderline personality disorder. And then, of course, there's group therapy or family therapy and couples therapy. So now I'm going to talk a little bit about barriers that Latinos face when they're seeking mental health treatment. Because studies show that racial and ethnic minorities in the U.S. receive more limited mental health services than whites. An analysis of medical expenditures in the U.S. has shown that the mental health care system provides comparatively less care to African Americans and Hispanic Americans, even after you control for things like income, education, and availability of health insurance. From 96 to 2000, Hispanic Americans were found to use prescription medications 6.1% less than whites. So there was this study in 2006 by Cabasa et al. Entitled Latino Adults Access to Mental Health Care. And in this study, they looked at 16 other studies, major epidemiologic articles, and 7 major studies. And what they compiled was there were several barriers, and they mentioned them. So number one, lack of health insurance, low acculturation, endorsing self-reliant attitudes, not knowing where to seek services, high economic strains, and having large supportive networks. Oh, I forgot to advance that. Okay. There's that. So I'll just mention some key findings or issues in this study. So Latinos in the U.S. underutilize mental health services, and this was one researcher at UCLA, a very famous researcher, Ken Wells, who looked at data from the Robert Wood Johnson Foundation Healthcare for a Community study, and reported that Latinos had greater delays in receiving mental health care than non-Latino whites, and were less satisfied with the care they received from the general mental health and substance abuse system of care. Young et al., also using the same data, reported that among individuals with depressive or anxiety disorders, Latinos and African Americans were less likely to receive guideline congruent care compared to their non-Latino white counterparts. Alegria and colleagues, using some of the NCS data, reported that after adjusting for psychiatric needs, demographic factors, insurance status, poor Latinos were significantly less likely than the poor non-Latino whites to use specialty mental health services. Another pattern of service use observed across these articles were that Latinos tended to rely more often on their primary care doctor as opposed to going to see a psychiatrist. You know, we've all heard that. Yo no estoy loco, yo no necesito ver un psiquiatra. Yeah? And so, but they might feel more comfortable seeing their primary care doctor, which is an entry point. It's a good entry point. Women were more likely than men to use mental health services in 6 articles. And being unemployed and being single were each found to be positively related to mental health service use. Higher income and higher educational attainment also predicted mental health service use among a nationally representative sample of Latinos. And low acculturation level was also found to be negatively related to mental health service use. This one last slide on this issue. Foreign-born Mexican Americans were also found to rely more often on the general medical sector, as I mentioned. Cultural interpretation of symptoms, like a stigma related to mental illness and its treatment, somatization of psychiatric symptoms, and the availability of general medical providers are believed to explain why less acculturated Latinos and immigrants underutilize specialty mental health services and rely more often on the general medical sector. So, and what I mean by somatization of psychiatric symptoms is that instead of talking to the doctor of feeling depressed, some people might say, my stomach has been hurting me a lot, or I've been having bad headaches, or I feel tired all the time. So not really kind of even thinking about, I'm feeling sad, down. Instead, it manifests itself in the physical aspect of it. So one concept that I think is very useful is this idea of explanatory models. And what an explanatory model is basically, it's a patient's understanding or an attempt to explain why they became ill. And I think we all have this. We all explain it in some way or another when we receive a diagnosis. This happened to me because of this. This happened to me because of that. Well, these explanatory models are very much influenced by our culture. You know, there's culturally acceptable ways of expression of symptoms. And also there's cultural explanations of how the illness is going to progress. You know, you might find some difficulties with the clinician has a different understanding of why you became ill, and the patient has an understanding of why they became ill. And a good clinician is going to try to identify that gap, realize that, okay, my patient is thinking that they became ill because, you know, a bruja put a spell on her. But you can try to help gap that understanding between their understanding and a more biological understanding. And you do that, a good clinician has the ability to do that. So it's a good way to think about it. So these are some more common explanatory models of illness, right? There's a moral model. And this idea is that you're ill because you have some moral defect. So how many of us have ever heard, when somebody says that they're depressed, somebody might say, oh, they're depressed because they're weak. If they were only stronger, they wouldn't be depressed. This is that idea. Or there might be a religious model to this, like you're being punished for something you did. This is why you're ill. Or there might be some kind of supernatural explanation to it. The idea of witchcraft or sorcery or gems or whatever it might be. There might be a different understanding of what's going on. Of course, there's the medical model where you're attributing illness to biological etiologies, and a psychosocial stress model where you're identifying stressors that are causing or contributing to illness. Oh, I forgot to do that again. Okay, so if you find yourself in need of treatment, or you have somebody, a family member or a friend who needs some help, this is a good place to start. This website, it's the Los Angeles County Department of Mental Health website. And as you can see, there's a phone number that you can call, or you could enter your address or your zip code and find local Department of Mental Health clinics in your area. You could also find urgent care clinics, mental health urgent care clinics in your area, or hospital psychiatric emergency rooms. There's a lot of information here. There's also this great resource, which Dr. Huerta had mentioned earlier. It's called the National Alliance on Mental Illness, NAMI. And NAMI is a grassroots organization that makes their aim education and advocacy. So you can find local groups, support groups, family members that have loved ones that have mental illness, and you can go and find where there's a local group in your city, around your area. They also host these talk to the psychiatrist nights. I've done a few of these. They're like Spanish. They can do it in Spanish too, and so you just kind of like this, where you'll have people asking questions about mental illness. So it is a good resource, and it'll help you educate yourself. Lastly, there's this resource. This is more kind of general resource for LA County. It's called One Degree. And here you can find resources in terms of, like, if you need health, of course, medical treatment, but housing issues, food pantries, legal help. This could be also a good website to look at. So with that, I will conclude, and okay. I'll take questions, I guess, afterwards. Okay.
Round of applause.
Okay.
That was very informative. Thank you, Dr. Cardenas. I'll schedule an appointment with you later. Okay, our second expert speaker is Dr. Antonieta Toriz. She works here on campus at Cal Poly Pomona in the counseling and psychological services. So when she speaks, I would like her to tell us about her actual role and how long she's been here and the type of services she provides, and then also the different capacities where she's been employed at and dealing with therapy and other type of services. So she has a master's. She has actually two masters. She has one of the masters and a PhD or a doctorate are from Trinity College in graduate studies. So please welcome Dr. Toriz.
Thank you, and hello, everybody. It's really nice to see all of you here. I was sitting there and I was recalling when I was doing my BA and my master's degree, how important it was for me to hear about my mental health and the support that I was receiving from mentors, coaches, psychologists, professors, and everybody who was helping me to stay focused and not giving up. I want to share with you a little bit about me, and then I will focus about the therapy, and I'm going to focus on the students and what is going on about emotional health with the students. Do you have some level of stress sometimes? Yeah, right? So I'm going to be talking a little bit, when is the moment when you know, oh, it's a good idea for me to go to the counseling center and talk to someone. And be proud of yourself by taking that decision. Because when you take action right away, you are able to go back right away on track and be successful in your career and your life. I had my BA in psychology in Colombia, and when I moved to this country after many years, and I'm very familiar with all the issues that we go as a Latinos adjusting to a new culture, new language, etc., etc. So I went back to school and I got my master in marriage and family therapy. When I was doing my internship hours and working with the Latino community, many issues came up about the faith and spirituality with the Latinos. And that motivates me to go back to school, and I got a second master it's called Master in Pastoral Counseling with the integration of spirituality and psychology, which is a huge component for us as a Latino. Our faith and our psychology, our physical health, emotional health, and spirituality. And I will talk about that in a minute. I was honored to receive both masters, and after 3 months, I went back to school for my doctoral degree in clinical psychology. When I was finishing my doctoral degree, I took an extra year to do a specialization in the integration of psychology and spirituality because I keep working with people, and there were many issues about holistic approach. What is holistic approach is that we are body, mind, emotions, mind, and spirit all together. We are not just like different parts. We are all together in one person. That's why we need that body, mind, emotions, spirituality, all be together in balance. One area that is out of balance will imbalance the other areas of our life. And I will check with you guys how you're doing about self-care, if you're having breakfast every morning before coming to school, because everything has impact in physical, mental, emotional life. And think about the times that you don't eat, how you feel during the day, about your mood, learning, memory, etc., etc. Okay? When I start working with the students, many students say what the Dr. Cardenas was sharing, I'm not crazy, I don't need to go to therapy. So I heard so much about that you motivate me, and I went back to school. And I got my national certification as a professional life coach for college students. And I'm going to explain what is that. I never heard about it. Because it's a services for students or people who doesn't want to go right away in therapy, but still you need some kind of support and help to stay on track and balance your life and be successful and be the full potential that you can be and reach your life, in your life, all the goals, dreams, and happiness that you want to reach, okay? So that was a little bit about me. I was working before at Fullerton, Cal State Fullerton. I worked over there 5 years as a psychologist and as a well-being life coach. And I just moved here to Pomona since July. And we start a new services, first time ever on campus. And I'm very happy to report that students are using the services that is have the professional well-being coach to help you to balance your personal and professional life and stay on track on your academics and personal happiness, okay? So let's talk a little bit about therapy. What is therapy? Why going to therapy? I maybe go to an advisor. Why I need to go to therapy? I don't want to walk to the bookstore and anybody to see me around the corner that I'm walking to the CAPS office or Counseling and Psychological Services office. Therapy is that time that you are going to invest in your well-being. Because well-being is body, mind, emotions together. And if you don't feel good in your emotions, your physical health and your performance as a student is going to be affected. In therapy, you are going to meet with a professional And you both are going to define the goals that you need in treatment after the evaluation from the therapist, and after, like the doctor explained, the therapist will check the criteria, see what is your diagnosis, but please do not feel that having a diagnosis is a label about who you are. Diagnosis is a tool for us to focus on what specific techniques, strategies we need to use in your treatment, because we want to be sure that you get in from therapy what you need. In therapy, I different modalities. When you come in with a counselor, here on campus, we have what is called brief therapy or short-term therapy. And I want to explain the difference between short-term therapy, long-term therapy, because sometimes people don't approach therapy thinking, oh, I'm going to be forever going and paying and talking with someone, etc., etc. By the way, you know, here on campus, you don't have to pay for counseling services. It's already included in your tuition as a student. When you're coming to therapy, and as soon as you and the therapist identify the treatment that is going to be developed during the sessions, the therapist will explain to you what is going to be the direction on the treatment. Maybe you need to be coming once a week, maybe every other week, maybe you only need to be here once a month. That's something that we cannot provide the answer on the first session until we run the evaluation, okay? Short-term therapy is between 8 to 10 sessions. Long-term therapy, or what is called ongoing therapy, is more than 10 sessions. And we provide the services in connecting you with the long-term services of a campus if you need more therapy after the brief therapy, okay? The studies show that the improvements from therapy you start feeling about section 4 or 5, and you feel it more about section 8, and usually by section 10 to 12, people are completing the process and people feel good. But I want to clarify something that is very important. People say, why if I went to therapy later in life, I have to go back in therapy? Because life is always about changes. New things happen, right? We don't know what is going to happen tomorrow. Look what is going on right now. The situation with the fires, the shooting, struggles with the school, family, relationships, divorce, economic issues, legal issues, health issues. Things happen. So it's really smart that as soon as you notice, I need help, I reach out for help. And when somebody say, oh, I'm not crazy to go to therapy, I say, that's good. That means you're very smart, because smart people reach out for what they need. And if you go to the doctor because your stomach hurts, it's normal to go to the psychologist because your heart hurts for emotional issues. Okay? So something very important that we need to recognize also is behind each one of us, there is a history. And think for a moment, the things that you and only you know, what are you holding in your heart and memory? And I see many heads going like, yeah. Think about your childhood. Think about your relationships, your parents, your country, your adjustments to relationships, maybe losses that you have in your life. We all have an emotional history. How is that emotional history for you? And that's what we work in therapy. Because when you have symptoms that start affecting your daily functioning, your concentration, your mood, your memory, your relationships, if you don't take care of that right away, those symptoms don't disappear because you're pushing them back. They don't disappear. Usually they becoming stronger until one day you can't take it anymore, right? And maybe you put it on other people how you're feeling. That ever happens to you? And later you regret because maybe you were yelling at someone or mistreating someone? So we need to check in ourselves. How is my body feeling? How is my physical health? How is my emotional health? How happy I am in relationships? How proud I am of who I am as a person, as a Latina, as a professional? How I feel with the people around me, how easy it is for me to make connections with others. When I am by myself, I feel loneliness or I feel okay with myself? Do I have friends? Are my friends healthy in my life? Or I choose toxic people that is taking me away from my goals and my dreams in life? So all those issues are issues that you can explore in therapy and working with your counselor. There are different kind of treatments. And Dr. Cardenas mentioned some of them, but I want to point to other of them. The treatments that we use when we are providing therapy services, they go according to your needs. There are some students or some people that they need the cognitive behavioral therapy, but some other students maybe need another different approach. I want you to be very aware that different therapists, different modalities of therapy, and different techniques in therapy are available for you. So if you heard from someone, because I heard this a lot from people, oh, my therapist is not good because he's not doing the same technique as your therapist, it's because you have different needs. And each one of us is so different. And we try to work as best as we can as a psychologist according to you, who you are, and your needs. 2 recommendations as you're working, if you want to approach therapy, be sure to select a therapist with cultural competence. What that means, that your therapist understands your cultural background. Because maybe I have a situation, and there is some sample on the internet, when a student came and say, I went to the psychologist before and I told the psychologist, oh, my heart hurts. And the psychologist sent me to the hospital, to the emergency room. But for us Latino, my heart hurts is I have so much pain because something is going on in my family. So you need to be sure when you're talking with your therapist that you are working with somebody who understands your culture, your language, your values, and of course we clarify the pain from the heart is physical or is emotional. We don't take risks. We care about you as a whole person, but we want to be sure that you feel that this therapist and the treatment that you're receiving is helping you in all those areas of your life and, are creating conflicts in other areas of your life. Latino families in therapy need to be very aware to identify with the therapist the value of the family. We're growing in this culture, but in our culture, the concept of family is huge. It's very important. Okay? So we need to be very clear about what is important for me as a Latino when you're working on your therapy process. Okay? Another issue that is very important when you're working in therapy is to identify if you are a first generation, second generation, if your parents are coming from born here or they coming from their different countries, because that has a big impact in the therapy process. I talk to many students who are reporting to me, oh, I can talk with my parents, language barriers or values barriers or cultural issues. So it's very important for us as a therapist to know what is going on in order to be able to help you. Students on campus in every single day are going through many different stressors, right? Money, classes. Don't be late for the professor class. If not, he closed the door and they don't allow anybody in. Big campus, transportation, food, housing, etc., etc. That sounds familiar? Okay. Homework, test anxiety, right? The levels of stress, we all need some level of stress in daily life, right? Because stress helps us to keep going on, to keep moving. But when the levels of stress are too little, that you are so in the position that you feel like, I don't want to do nothing, that's kind of leading into depression. But when you have too much stress, that you can't focus, that you can't finish projects, that you're shaking, that you feel these physical and emotional symptoms, maybe you're coming in the area of anxiety. So we need the right amount of stress in order to function in life. Very important that you know that we have on campus resources available for you. You can walk and just have relaxation session. where somebody who is trained in that area, professional, will help you to focus. We help you to relax. We have 21 counselors right now at CAPS. We have the well-being coaching, that is the position that I start here on campus. When I'm working with you on issues related with procrastination, that sounds familiar? Procrastination, stress management, healthy relationships, dating, first time in romantic relationships, decision making, changing majors, family issues like skills, how I'm going to communicate with my parents. What is the difference between that and counseling services and therapy? In therapy, you go in a deeper process and you explore aloud past and present. In well-being coaching, we are going to be working with you in where you are right now and where you want to be and what is in the middle, where you're getting stuck. We are going to work on the present, the here, the now, what skills, what tools you need to go back on track. You can finish homework, let me help you to identify why, and let's work on the solution. It's focused on the positive psychology, solution-focused interventions. And there is a treatment in psychotherapy and well-being coaching that is called Dr. help me, the basic interventions therapy or report is that we have these studies that the short treatment is based on interventions that we can prove the results in 3-4 sessions. So it's very helpful for college students because you don't have to invest big amounts of money, not money, but time in working on a specific issue. But because I have my training in psychology, if you have the need for emotional issues, I will help you with the transition in counseling services. I always tell students that, you know how heavy is your backpack sometimes, right? You carry so much, right? Just imagine that you have a backpack and you have been putting in that backpack the rocks of emotions that you're holding for a long time in your life. How that will be unfolding, unloading all those emotions and become free to be you, become free to enjoy school, become free to be able to concentrate in classes, become free in order to be happy, in order to connect with your Latino family, to love your culture, to love your traditions, to love your career. And like Dr. Huerta mentioned it at the beginning, here are the future professionals. One of you will be here maybe in 2, 3, or 5 years. That's the dream. Many of you will be the professors, the psychiatrists. Maybe the next president of the United States is here. Okay? Doctors, architects, engineers, nurses, professors, in all areas. All the careers are important. But the first step is how much you love yourself, how proud are of who you are. Where are you today? What you need in order to be all what you were born to be and use the full potential of who you are. As I shared with you at the beginning, English is my second language, and I came to this country and I was never imagined that I was going to be holding 4 or 5 degrees and I was going to be in national TV advocating for college students' mental health for Latinos. And any of you, can you do that? What was the secret for me? Reaching out to counseling services, reaching out to the psychiatrists, reaching out to my mentors, reaching out to my well-being coach, self-care, eating, sleeping, connecting with healthy people, time management, stress management. All those issues are very important. What happened with Latinos when we talk about therapy? One, we don't want anybody to know, right? I don't want anybody to know that I'm going to therapy. It's like we're hiding something. Why? That's part of our life. We're not hiding that we went to the doctor because I have flu, right? Why we need to hide that we need support and help in mental health, okay? It's very important, and this is my last message or recommendation here, that we normalize the conversation about mental health with our family and our friends. Don't play around labeling people with the diagnosis of mental health. You don't know how much people suffer when you call them by names related with mental health. We all have history, and we all, in one point of life, like the doctor said before, we have some mental health issues. Could be stress, could be sadness, could be depression, could be the loss of somebody, divorce, etc., etc. Okay? So let's normalize the conversation about mental health. What's your name? Armando. How normal will be to say, hey, Armando, how are you today? How are you physically today? What you will say? Good. How is your mental health going? How that feels? Ugh. So we need to get to the point that that question is very normal. If you identify a friend who is changing behaviors, who looks sad, who looks a little crampy, or if you notice you're affecting the relationship with your partner, with your family, please check inside what is going on and reach out for help. Let people know how you're feeling. And if you notice a friend that is making those changes, say, you know what, I care so much about you that I'm going to walk with you to the place where there are professionals that can help you. I love you, I care about you, you are my friend, but I don't have that training. You have my friendship. That's why I'm walking with you to the people who can help you. Walk with your friend to counseling services, to professionals. And as a Latinos, let's be proud that we value mental health and that we advocate for mental health in our community. By the way that we talk to our family about mental health, by the way that we feel about our own mental health. And that's my last statement. How you taking care of your own mental health. Because we need to take care of mental health as we're taking care of physical health. Everything impacts the mind. So let's think about it. And if you need somebody to check in, you know where I am, counseling and psychological services. Believe in yourself and the full potential that is in you to be successful. Thank you.
That was excellent. I have to make 2 appointments now. I'm all stressed out. Such very informative. I'm so amazed how much I've learned today. And what we're gonna do now, just do a Q&A. So this is gonna be like Oprah here. Somebody's gonna pass the mic and ask a question, but a poor, skinny Oprah, because I can't give away a car. I could give away a piece of pizza. So we're gonna have your fellow classmate here is gonna pass around the mic, ask a question, refer to either Dr. Cardenas or Dr. Toriz or both of them in regards to like who do you want to answer that question. So he's gonna pass you the mic.
Actually, I have a question.
You have a question? That's kind of cheating, no? Because you're.
I'll save it for last.
No, go ahead and ask a question.
Okay.
First question.
Okay, Dr. Cardenas. So with respect to antipsychotics and
No, but
oh, sorry. Here we go. All right. So with respect to antipsychotics, we have the first generation, such as lithium, and it's been established that there's a lot of repercussions with the medications, and even with the atypical antipsychotics, such as olanzapines. Individuals have to have their blood levels checked for high triglycerides, and even diabetes could be the case. Now, I was curious: is there research going on for a third generation of antipsychotics, perhaps something with less repercussions, negative side effects that will still perhaps balance the brain chemistry?
Yeah, what I would say is that there's.
Restate the question.
Oh, it wasn't. So I think the question was in regards to side effects, and the mention was on first generation, second generation antipsychotics. But I think more, and then the question is there research going on for, like, say, third generation antipsychotics that have less side effects? So what I would say is that all medications have potential side effects. Even something as benign as you think of like Tylenol or Motrin, all medications have side effects. And the issue is to choose a medication that a person can tolerate, so that there's side effects. There may be some side effects, but they're okay with those, or maybe there are no side effects and they're tolerating it well. So it really is a person specific. Like, so you try the medication, you see how it works. If there's side effects you cannot stand, there's other options. So you could always go to different options. In general, like the first generation antipsychotics, as you mentioned, they tend to have more what we call extrapyramidal symptoms. So these are like tremors or muscle rigidity. And the newer generation or second generation atypical antipsychotics, they tend to have things like you mentioned, people can gain weight on them. But not all the medications are, let's say, equal in regards to the side effect. There are some atypicals that don't cause any weight gain. And then there are some that most of the time they cause some weight gain. So what I would say is work with your doctor, talk with your doctor about the side effects you're having, and then you can decide whether it's time to move on to the next medication or try a different one. Because usually you can find one that you're okay with. Now, in terms of research, there's always research going on in terms of newer antipsychotics. I don't know if we would call them third generation at this point. I don't know if like they have, let's say, because they all target the dopamine system. And so I don't know what the new brand of antipsychotics are going to be termed, if they're going to be termed third generation or not. But I would say, though, that even with those, there's going to be side effects. We can't escape the issue of side effects when it comes to medications. Question is, whether you as personally are experiencing those side effects or not, because you may not, and whether there might be a side effect that you're like, I'm okay with this. That doesn't bother me so much.
Thank you very much, Dr. Cardenas.
Okay, next question. Come on, y'all. You get a cookie if you ask a question. Okay, aquí, right here.
Okay, so I have two questions. So my first question is, I'm a nutrition major, and one of my career goals is to do research on how nutrition affects or causes mental health disorders later on in life. Do you know anything or know anyone about how what we put in our bodies affects or causes mental illness later on in life? Like, do you know any research or anything?
Yes. So the question is, how does our nutrition affect our mental health? Mm-hmm. That's in general terms.
Yeah, or cause it. Later.
Or causes it. Yeah, sure. I mean, like, so if you have deficits in certain vitamins, like say like vitamin D, you can have symptoms of depression. What I would say is a lot, deficits in certain parts of aspects of your nutrition can mirror symptoms of mental illness. So it is helpful if you're having symptoms of, let's say, depression, to have a full physical exam, to get general labs done, and because it could be that in rare cases it could be that things can be thrown off, and if you just get supplements, that'll help with that. Things like vitamin B12, for example, kind of very low vitamin B12 can affect your cognitive status, so it could cause issues with memory and that kind of thing. So yes, I would say though that it's our rare cases, but yes, having poor nutrition is gonna have you can have symptoms of mental illness.
Okay, and then I have another question. So, thanks. So I've noticed that whenever I talk to like the men in my family, when I say, oh, maybe you should go talk to a psychiatrist, they're way more like resistant, and they say, how you were saying, like, I'm not crazy, I don't need to go get help. Like, do you have any like tips on how to talk to the men, Latino men, about this? Like how to encourage them to go get help?
Yes. One of the points, very important, that I mentioned is we need to start opening the conversation, like a normal conversation in family, right? Like, oh, I went to school today and there was this amazing workshop about mental health. Start bringing the conversation as a normal part of the family. It is true that the Latino males, they have more resistance to therapy than the Latino women. And that's because the cultural issues, traditions, different mentalities about what is mental health. Okay, there are different services, resources in order to help men Latinos. There are support groups for men. I think we need to start taking the steps little by little. Organizations today, the church communities, they offering support groups for men. And it's not necessarily right away therapy or going to the psychiatrist, but it's start like working on the stigma about mental health. Now, medical doctors are amazing about helping the Latino families, Latino doctors, and creating that set of mind with the men when they go to the physical checkup. Okay, and they can have that open conversation. Like I said, the tendency with the Latinos is kind to hide that I have any emotional problem or my family is going through any struggle. Okay, reach out to support people who maybe, there is people who do the visits at home just to bring awareness, and I can provide that information. Usually in the packages that I give you, there are lots of resources about community services. I know NAMI, there is a list there, and you can get the magazine for free. You just register with them, and they will send magazines and material about all these topics in mental health. And they have support groups also to give some orientation to the family about how to start opening the conversation, and there is a specific area for the male and the mental health issues. Okay?
Thank you.
No, when you're dealing with cultural, with generational issues, it's a little bit more difficult. Especially if somebody is older and has like that mindset from like more traditional, so it's going to take a little bit of time. But let's not kid ourselves. Well, one, women are smarter than men, so that's why women seek support and men don't. So that's number one. The second thing is this idea of like, it's like pride, right? So this is a thing like you want to be tough, and it's just like what Dr. Karen was saying about being weak. So they see it that way. But the last thing is that men do seek therapy, but they don't call it that. Like when they're talking to their compadres or they're getting drunk or whatever, that's a form of therapy. They're seeing that, but the problem is that they're seeing somebody who's kind of reinforcing the same problem, the mindset. But there is therapy going on, but it's not professional. So part of it, I think, for young people like yourselves, is to educate your parents, and it's going to take time. I mean, it's not going to be overnight because it's a cultural shift. It's and all that. I mean, one of the other issues, like with Latinos, contrary to some of the stereotypes that are out there, is Latinos value work more than anything, especially like men, or women too, but like in terms of like for a male Latino, like especially like my parents, like from the countryside, like from the rancho, like the farm workers and all that. If they base their manhood based on your work, that you can work. So if you're lazy, si eres flojo, that's up there with being a thief, like vale, no sirves para nada. Because they value work so much. Now, if you suffer from depression and you can't get out of bed, they see that they interpret it through those eyes, and they see it as being lazy. Because that's how they define it that way, and not as a mental illness issue. So this is part of like the misdiagnosis and what's going on, but it's a generational thing. So I think it's incumbent upon your generation to educate your parents, but it's going to take time. And si no hacen caso, yo sé Dr. Huerta said this, and él sabe más que tú, so tranquilo. Okay, next question.
How often do you guys see cases where it's a young Latino, whether men or women, are coming in for asthma symptoms and maybe laziness, like you said, that are relatable to people living in low-income communities or next to freeways and stuff like that?
So the question is asthma symptoms that are related to more like being near a freeway, or?
Well, so like my little brother and I have a few cousins that lately they've been complaining about migraines or headaches, or they're getting worse as they get older. And in the Latino community, like I joke, like, oh, you guys are young, you guys are weak, that's why. But in reality, we had the guy from Breathe LA come in, and he was saying how they've been finding that there are a lot of young people living in low-income communities, living next to freeways, that get affected by the chemicals they breathe off of these roadways. How often are you guys seeing that, or is that something just coming up recently in your guys' research?
You know, what I would say is that it's important to get, like I referenced earlier, a good physical exam. When you have symptoms like feeling tired or difficulty breathing, or whatever the symptom may be, it's a good entry point to see, in the case of a child, a pediatrician or a primary care doctor. And what usually will happen is the primary care doctor will do the tests that they need to do, check general labs, and if they can't find a reason, and also there might be some component of a psychological component, that's when they might make the referral to a psychologist or to a psychiatrist. But if you're having physical symptoms, it's important to see your general doctor, is what I would say. And once the medical aspect of it, and I mean non-psychiatric medical aspect of it, has been ruled out, then you can move on to seeing a psychiatrist or psychologist. But I have also heard issues related to kind of increase in people's blood pressure who live in a very trafficky zone. So that, and it could just intuitively, right? If you're living in a zone where it's high volume, lots of noise, it's gonna increase your maybe your anxiety levels and your blood pressure. So I have heard of that.
Thank you.
But that was an excellent question. I'm just gonna, we only have like 2 minutes, and I know people have to go to another class, lesser class than mine, but that's okay. It's not their fault. I just want to wrap it up here and just say a few things before we go. The first thing is, thank you very much for everybody showing up. I was so nervous. I was suffering an anxiety attack yesterday. I thought it was only going to be us three and my son joining us by Skype. So I'm so happy that everybody is here, and the millions of people seeing us on YouTube. That's number one. Number two, I'd like to thank everybody that helped support this event, Dr. Coley, President Coley, Dr. Gomez from the Student Services, the Dean Wu and Dean Pasi, Dr. Cardena, our speaker here, Dr. Toriz, also from EWS, the chair, Dr. Dixon and Dr. Cadena, and from Urban Planning, Dr. Wilson and Uri, and the student groups and everybody that supported it. And for me, it's a question of everything that I do is not just academic, but it's also personal. So this is important, and it's important that all of you, whoever suffers from depression, to value yourself, and if you want to be successful, seek help. Only successful people seek help. The richest, the most successful people in the world see therapists. It's just something that they do, and poor people, working class people, young people, need to catch on to that, in order to be successful. So for me, it's a question of bringing role models, such as the doctors here, that come from the same backgrounds that you all come from, so that you can see yourselves in them, and even someone like myself. Not as funny, but it's okay, it's not your fault. But so you can see that there are people that look like you that come from the same background, first generation immigrants, son of immigrants, attending this great university, and being able to not only see yourself as students, but as role models yourselves and future leaders, to educate the new generation and the older generation more than anything about these important issues, and to diagnose things accurately without any fake news, and so that our people, the working class people, can get the help that they need. So with that, like we say in East LA, muchas gracias, and I dedicate this to my brother. Thank you. Noel Huerta. So please fill out the evaluation, and we're going to stick around for a little bit to answer questions. Thank you.